Deborah is an active woman that enjoys spending time with her friends and family.
Well, I was working full-time, cleaned my house, did yard work, went to the movies, socialized with friends and family. Since 2014, I have been in chronic pain. I have no life. I wasn't able to enjoy the things that I used to. And I don't know what brought it on. It was just, I was working, I started having pain. It was in my low back and went into my butt cheeks, the inner thigh, outer thighs. I had throbbing, burning, stabbing. From one end of the spectrum to the other, I experienced that pain. And I had developed numbness in my big left toe. It prevents me from walking, sitting, or standing for any length of time. I would walk with a walker and sometimes without a walker. It just depended on the day.
Initially, she sought help from conservative treatments.
I saw my primary care physician, and she put me on a steroid. 2 weeks later, I'm back in her office. I didn't get any relief from the steroid treatment. So then she gave me some shots. She had diagnosed me as having trochanterous bursitis, and I got multiple shots in that area with no relief. I saw 16 different specialists. I went to 3 different pain clinics, and I had multiple physical therapy. And the physical therapy actually made everything so much worse. It aggravated it. And when I would come home from physical therapy, I was in bed.
When nothing provided relief, she was diagnosed with an annular tear in June of 2020 and underwent a spinal fusion at the Mayo Clinic.
The surgery didn't give me any relief. I had the same identical symptoms that I had before I had surgery. They had me wear a pain patch for a week, and then you would change out the patch. The side effects, getting nauseating, and it wasn't helping me. I wore the patch for probably 2 months and told the doctor, this patch is not working for me. I was just like, nope, I am tired of going to all the physicians in my local area and not getting any relief whatsoever.
After fusion surgery failed to alleviate her pain, Deborah wasn't sure what else she could do. Then one day while watching TV, she learned about the Bonati Spine Institute.
And I happened to just catch Dr. Bonati on Newsmax, and I thought about it for a while, and then I started going into the Facebook page for Bonati, went on YouTube, and listened to other testimonies from other patients that have been treated here. And to be quite honest with you, I was tearing up because I thought, oh my gosh, this person has the same issues that I have, and that they were able to help that patient.
With renewed hope, Deborah contacted the Bonati Spine Institute and sent her MRIs in for review. Dr. Bonati called her personally to discuss her case and told her she would be a good candidate for his procedures.
When Dr. Bonati, said I was a candidate, I was very excited. But then because of my past experience at a spine institute, I had my doubts, And when I got here, they said they could help me.
The exclusive Bonati spine procedures are performed incrementally using conscious IV sedation, where the patient remains awake and interactive with their surgeon. This technique is used to ensure the source of their pain is eliminated.
The surgical experience was wonderful.
One benefit of incremental surgeries is it gives the body time to heal.
I had 3 surgeries. The first surgery, I had immediately relief on my left side, and I was overjoyed. Not having any pain in my legs. So that's awesome. And they did tell me that it's not uncommon for patients to think that it's only on one side when it involves the other side as well. So that's why he decided to go into the right side and and work on the L4, L5, I believe. It's going fairly well. I still have some pain on my right side, but there's more surgeries that are planned, and it would involve the L5, S1, and then possibly removing the hardware, because the hardware may be pinching nerves and, in a different area.
Any pain going down your legs or your butt? Nope. No, nothing in the front or the side?
Nope.
Wonderful.
Wonderful.
Okay.
After surgery at the Bonati Spine Institute, patients are encouraged to walk a few times a day to aid their body in the healing process.
They recommended that I do therapy at home, walking about 20 minutes a day, and gradually increase as I can tolerate. And I'm to do stretches because you can develop scar tissue, and that's with any surgical procedure. So if I continue to move around, it should loosen up and I should heal quicker and not develop any more scar tissue.
Now on her way to living a pain-free life, Deborah is looking forward to spending time once again with friends and family.
Going on a walk with my husband and my dog. He walks our little dachshund every weekend, and I'll be able to start, hopefully, joining them on that walk. And he does at least 3 miles.
Deborah highly recommends the Bonati Spine Institute to anyone suffering with neck or back pain.
I am so thrilled that I've gotten relief. Come to Bonati Spine. You will be very pleased.